Have you ever wondered, does salt affect lupus? If you want to find out, then keep watching. Salt is something that a lot of us like to have in our food. And lately, I've been using this mushroom seasoning that has some salt in it, but I've been putting it in my broth. And I've got this from an Asian store and it's so tasty. Sometimes when I want a salt craving fix, sometimes I just take a little bit of it in my mouth to curb that craving. So literally you can put that mushroom seasoning in boiling water and add some tofu and some bok choy in there and make a nice soup out of it. If you or someone you know keeps getting lupus flares and you're not quite sure what the cause of it is, it could be salt. And before I keep talking, I would really appreciate if you can like this video, subscribe to my channel so I can keep spreading awareness about integrated medicine and autoimmune diseases. So how much salt should we be consuming in one day at max? Have you ever looked at the salt content of a Big Mac at McDonald's? Or how about the salt content in a small bag of chips? We usually overlook the salt content, even though it's so important. Why don't you comment below and tell me how much salt we should be consuming at most in one day as set by nutritional experts. And a bonus question, how much do you think that translates into a teaspoon? Is it 2 teaspoons, 3 teaspoons, 1 teaspoon? Take a wild guess. We'll answer that question at the end of this video. We often look at the protein and carb numbers in our food, but we rarely look at salt. So if you're not looking at salt, it might be time to evaluate how we look at nutrition labels. So what happens to you when you flare with lupus? Do you get more joint pains, more brain fog, headaches? Do you get more rashes? Do you get more chest pains? Or do you have lupus nephritis, which is lupus of the kidneys, and that can worsen? There are so many ways that lupus patients can manifest their flares, and every single lupus patient is unique. Our ultimate goal is to put lupus to remission and remove all flares. But first, we must talk about salt, because salt can potentially contribute to your flares and could be the #1 culprit why patients keep flaring over and over again. So today I'm going to be presenting a couple of scientific articles to talk about how salt affects lupus patients. So study number 1, this study looked at mice and it showed that these mice that were fed a high salt diet had their lupus activity accelerated. And it showed that these dendritic cells, which is part of our immune system, was much more activated. And based on this study, the consensus and conclusion, dietary changes could improve lupus activity. Study number 2 looked at whether salt worsened lupus nephritis or lupus of the kidneys. So what they did in this study was that they fed the mice a high salt diet and a normal salt diet. And what they found was that multiple markers of lupus were actually elevated in the high salt diet group. So the high salt diet group with the rats, they had higher double-stranded DNA levels, which you want to go down in lupus. They had higher urine protein levels as well. So in lupus patients, we monitor their urine protein because that's a sign, if it goes up, that there might be lupus attacking the kidneys. In the rats that were fed a high salt diet, their T helper 17 cells were elevated. And T helper 17 cells are your pro-inflammatory T cells. So you definitely want those to come down. So based on these 2 studies on rats, it does show that high salt can worsen lupus. And I'm going to talk about other autoimmune disease and salt in the future, but today's talk is going to focus on lupus specifically. So you want to be very, very careful of having salt in your diet. You can have a little bit, but definitely watch out when you eat out or eat packaged food because it's creeping in there and it's hiding. Now let's look at this website and article from the Hospital of Special Surgery. And it talks about lupus and diet and other factors affecting lupus as well. Let's scroll down here and see what it says specifically about salt. To aim for less than 2,000 milligrams of salt a day. Nutritional experts recommend less than 2,300 milligrams of salt a day. So that's your answer to the first question is 2,300 milligrams of salt a day. So it's not just studies that are talking about, even educational websites such as Hospital for Special Surgery are talking about lupus and how salt affects it. And not only does salt affect lupus, but it can also contribute to heart disease, strokes, high blood pressure, edema or swelling of the legs, and it can also contribute to kidney disease as well. So I wanted to bring this topic of salt because it is often overlooked. I recently gave a talk in Omaha, Nebraska on how to use integrative medicine and diet to help treat autoimmune diseases. And salt was one of my topics in this talk. You really have to read your labels when you guys buy food. And you have to be careful of the salt content, canned soup, canned vegetables, breads, cereals, soy sauce, frozen pre-made meals, smoked meats, processed meats, and also ultra-processed foods. You really have to be careful of the salt. I cannot reiterate that enough. So sometimes when I cook at home, I try to cook as much as possible with just plain water, and I salt as needed. And as I mentioned earlier, salt does contribute to a number of different diseases in addition to lupus. Okay, so you got the answer to the first question, which is 2,300 milligrams of salt a day at maximum. And that actually translates into 1 teaspoon of salt a day. So 1 teaspoon is very small. So you can imagine most of the world and USA, especially the developed nations, are probably consuming too much salt for our own good, and we're adding fuel to the fire for inflammation. So if you do like this video, please like this video and hit the subscribe button so you can support my channel. And I thank you for all your support.